Let's study about cardiac glycosides. Cardiac glycosides are a group of naturally occurring compounds derived from plants and other sources, used in medicine to treat heart failure and arrhythmia. They are usually derived from plants such as Digitalis purpurea, Digitalis lanata, and others. Examples include digoxin, digitoxin, bufalin, oleandrin, etc. Digoxin is the most commonly used cardiac glycoside derived from Digitalis lanata plant. It is primarily used to treat heart failure and certain types of arrhythmia. Now try to understand its mechanism of action. Digoxin works by showing positive inotropic effect as well as negative chronotropic effect. In positive inotropic effect, digoxin inhibits the sodium-potassium ATP ACE pump in phase 4 of the cardiac action potential. Normally, in every cycle, this pump expels 3 sodium out from cell and brings 2 potassium inside using ATP to maintain the electrochemical gradient in heart cells, which is essential for the heart to rest and prepare for next heartbeat. You can see diagram of sodium-potassium ATPase pump on screen for your better understanding. So when digoxin inhibits the sodium-potassium ATPase pump, the level of sodium inside the cell increases. Elevated sodium reduces the activity of the sodium-calcium exchanger pump, which normally expels calcium from the cell in exchange for sodium. As a result, intracellular calcium increases, especially in the sarcoplasmic reticulum. Now more calcium will be available for release during each action potential, which enhances myocardial contractility. Thus, digoxin provides improved heartbeat to the patients suffering from weak heart contractility. Now let's talk about the negative chronotropic effect of the digoxin. It increased the activity of vagal nerve, which is one of the most important nerve of the parasympathetic nervous system. The vagus nerve releases acetylcholine, which helped to decrease heartbeat of the body. Thus, increased vagal tone helped to slow down the heartbeat and provide relief in arrhythmia. Take a look at the adverse effects caused due to digoxin. Digoxin can cause toxicity in arrhythmia if body is suffering from hypokalemia, which means low potassium levels in body. On the inhibition of sodium-potassium, ATPase pump potassium ions play an important role to restore its function. But when potassium levels are low, there will prolonged inhibition of sodium-potassium ATPase pump. At this time, the higher calcium level in heart cells will lead to arrhythmia or irregular heartbeats. So hypokalemia must be treated before starting the digoxin therapy to the heart patient. Other side effects are nausea, anorexia, vomiting, diarrhea, dizziness, etc. Subscribe for more. Thanks for watching.